and welcome back to my channel. If you don't know me, then my name is Lucy and I'm a fourth year medical student studying at the University of Nottingham in the UK, and I haven't posted a video for quite a while now, so I thought I would make a video today to just catch you up on what's been going on, why I've not been able to post videos, and yeah, just kind of let you know how medical school has been going over the last few weeks. So the last video I made, I had just started my fourth year placements. So at the moment I'm on my Obs and Gynae rotation, so obstetrics and gynaecology, and I'm really enjoying it. To be honest, I'm wondering how any of the other placements are going to be any better than this, because honestly I have really been enjoying it so far, but it has been extremely busy. So Obs and Gynae, for anyone who doesn't know, isn't in the medicine field, then obstetrics is kind of like the care of pregnant women. So that's antenatal care, that's the sort of labour and the delivery of the baby, and sort of complications of the deliveries. So the women presenting to an obstetric doctor, they might have abdominal pain in their pregnancy, they might have reduced fetal movements, they might have a baby that is small for gestational age or large for gestational age, they might have gestational diabetes, they might have preeclampsia. The other half of the placement is gynaecology, so that is essentially women's health, anything to do with the vagina. Yeah, it's kind of a really interesting speciality because it's these two different areas of medicine together. I've also really realised how it is really a combination of medicine and surgery. Like, there is quite a lot of surgery in Obs and Gynae, and I think that's one thing that's sort of quite unique about it, because other sort of areas of medicine, they will either be a medicine speciality or a surgical speciality, but Obs and Gynae really does feel like a mix of the two. So yeah, I thought to start with, I'll talk you through my first few weeks. So it's the weekend now, but I'm starting week 6 out of 8. So I've got 3 weeks left and I've done 5 weeks. It doesn't feel long enough. It feels like I need so many more weeks to cover everything I need to cover and to get as much experience as I can, but because of COVID, we're having sort of slightly shorter rotations, so I'm just kind of having to make do. But yeah, so essentially my first week, I think I'd already made a video at this point, and so my first week was essentially half and half days. So like, we'd spend the first half of the day having teaching to teach us like the basic skills, like the basic examinations you need to be able to do in Obs and Gynae, how to interpret CTGs. It measures like the fetal heartbeat, the maternal heartbeat, the contractions of the mother and things like that. So we were learning how to interpret them, and yeah, sort of general practical skills and sort of the basics of Obs and Gynae. And so we were doing teaching in the morning, and then in the afternoons we were just, it was very flexible. I think I've said this in my previous video. It was kind of like, just go and do what you want to do. So you go to a clinic if you want, you could go onto a ward, take a history from a patient, anything really, just fill the time yourself and get a bit of exposure. And I think that was a really good way actually to start the placement off. Then my next week after that, I was on my sexual health attachment. So the sexual health week was in the community. So I went to a sexual health clinic Monday to Friday, 9 till 5, and just saw the patients, had the opportunity to sort of take a sexual history, just see sort of what goes on there. So obviously that's like the STI screening, HIV patients, contraception, so people having coils inserted or implants inserted or removed. And so yeah, that was a really interesting attachment, and I think as well I'm quite glad it was sort of the first thing I did, because it kind of eased me in. Like, it was quite a gentle start, in that you just kind of went and you sort of sat through the day. It was very structured, we knew what we were doing, and sort of the later weeks after that have become more and more chaotic in a way. And then after that week I had labour week. So as you can imagine, labour week is going to be with women on the labour ward who are in labour, and getting involved with the deliveries if possible. Yeah, this was an interesting week, because the thing is, with the hospital I'm at, it is quite a small hospital, and so it's not like there are hundreds and hundreds of people in labour all the time. There's kind of like maybe 3 a day. Some days it'll be very quiet, there might not be anyone in labour. Some days there'll be 3 or 4 people at once in labour. So yeah, it was kind of, I had to be quite flexible to fit in with who was there. So there were times when there was just no one in labour, so I just kind of found other things to do. And then obviously labour itself is a very long process. For some people it can be really short, but for a lot of the women that I was with, it was kind of a 12-hour, if not longer, process. And so I spent a lot of my time with women, so just sort of sat in the room with them while they were sort of having their contractions, and sort of checking the CTG, so looking at the trace, looking at the fetal heartbeat, practicing like putting the CTG on, taking sort of the blood pressure of the woman and things like that. But I think it was a really valuable experience to sort of sit through a whole labour from the start to the end, because then you can really experience the whole process and how it progresses. And so yeah, I really enjoyed that. I saw a lot of deliveries, which was good. So I saw a few normal births, so just normal vaginal deliveries. I saw forceps delivery. I saw an attempted Von-Teuse delivery. So forceps and Von-Teuse are like instrumental deliveries. So if the baby isn't going to be pushed out, on its own, you need a little bit of help to pull the baby out. I've got to see C-section. So yeah, all in all, it was a really, really great week. And I've also been able to deliver a baby, which was honestly such an amazing experience. And what was even more special about it is the woman whose baby I delivered, I actually met her the day before on the antenatal assessment unit. So I'd met her before she was in labour, and then I went and saw her when she was in labour, and I was with her for essentially the whole process. And then delivered her baby at the end. So yeah, that was a really sort of special day for me. And yeah, something I will definitely remember forever, bringing a little human into the world. And so yeah, Labour Week, a very a long and sort of, I had to be very flexible. So obviously if I'd been with a woman in labour for 8 hours already and she was so close to delivering, I wasn't going to just think, oh, it's 5 o'clock now, I'm going to go home. So I was doing sort of long shifts that were going sort of late into the evening. But again, it was a good experience. It was good to get that sort of experience of a long shift, because I think we are quite pampered in medical school in that in the past, it's sort of been like, okay, go in for a morning or go in for an afternoon. But this year I feel more like I've been doing what the actual doctors do, like the actual long shifts, which is a good experience. So yeah, that was Labour Week. Really, really exciting. Then after that, I had what is called Consultant Hot Week. So this is where you kind of shadow the on-call team. So the consultant that is on call for that week. So you go to the morning handover, so there'll be the midwives there, the doctors, and they will discuss all the patients, and then you go on the ward round. So that's really great because you get to see sort of the patients on labour ward, the patients on maternity ward, the patients on the gynae ward. And then in the afternoon, it was kind of shadowing the on-call sort of junior doctors, and so they were the ones that would be seeing the patients from A&E, so like the gynae patients coming in from A&E. So I was able to sort of clerk those patients and sort of take a history from them and present it to the doctor, which was really good. Also being on the antenatal assessment unit, so patients coming in with sort of potential problems in their pregnancy, so getting to sort of feel the ladies' tummies, feel where the baby was and things, so that was also good. So yeah, again, that week was like quite a sort of flexible week of me kind of having to decide where I wanted to go, when, who I wanted to shadow. So it is a lot of, having to make decisions for yourself and for your own learning, which I think has been a big challenge, because in the past, medical school's always been very timetabled. So yeah, it's kind of pros and cons, it's the difficulty of having to decide all the time what you want to do, but it's also the freedom of being able to think, actually, I've seen quite a few gynae patients, so maybe tomorrow I'm going to head down to the antenatal assessment unit, or vice versa, and sort of doing the thing that's going to help your learning the most, which I found really good actually. And also we have a logbook of all things that we need to get signed off, so certain things we need to see and do, like doing examinations and things. So yeah, because we've got so much freedom, it's sort of easy to kind of direct what things you want to sign off each day. Then moving on to last week, I had a sort of week off. So I don't mean a week off, I mean I still went in every day, but I didn't have anything specific that I was timetabled to, so I could just kind of do what I wanted to do. So yeah, I spent last week sort of attending clinics. I went to theatre and I saw a hysterectomy, so removal of the uterus, which was really, really interesting, and I got to, really watch that up close, which was good. I forgot to mention as well, pretty much every lunchtime we have teaching as well, so it's very full on. So we'll have our morning being on placement, like being in a clinic for example, and then sort of like at 12 o'clock we'll have an hour teaching with a consultant covering a particular topic, and then we'll sort of quickly eat our lunch and then in the afternoon go to another clinic or go onto the ward or something. So yeah, all in all, I have really been enjoying it. I have another week off. Well, week off, I say, I mean a flexible week coming up, and I've got then my specialist clinic week, which is where I go to all the sort of specialist clinics, like fertility clinic, for example. Yeah, then I've got another free sort of flexible week, and that will be the end of my Obs Gynae placement. But yeah, I've really been enjoying it. I will try as hard as I can to do like a day in the life vlog or a week in the life vlog, but the issue is I'm just in the hospital all the time, so it's very difficult to film anything. But yeah, I just kind of wanted to film this video to update you on what's going on, explain why I've not really been filming, and it's just been because I've been so busy, and I honestly, especially on Labour Week, I could barely find the time to actually have a rest. And so yeah, I was struggling to prioritise sort of filming videos or editing videos, but I'm a lot more settled now, so hopefully I'll be able to get some sort of vlog out in the next few weeks. I'll try, but I can't promise anything. I never want to feel like YouTube is like a chore. I always wanted it to kind of be a thing that I really enjoy doing, because if I'm enjoying filming the videos, I think they'll be so much better than if I'm kind of forcing myself to film something when I don't really have time. Do stay tuned, because I will be posting on this channel more. It's not like I've just ended my YouTube channel. And yeah, I hope everyone is doing well. If you've started medical school this year, then I hope it's going well for you and you're enjoying it. If you've applied for medical school, then congratulations for sending off your application, and I wish you luck, and I hope you get those interviews, you get those offers. And yeah, whatever you may be doing right now in the world, I hope you are having a good time. So thank you very much for watching, and I will see you very soon for my next video. Bye!